joined us this evening.
Recording has started.
Good evening, everyone. My name is Carol Lisk, and I'm the president of Psi Upsilon, and I welcome you to our Psi Upsilon program on reflective practice, learning from experience to transform practice. Our speaker today, we are just so delighted to have with us. Dr. Gwen Sherwood is a PhD and also a fellow in the American Academy of Nursing, and she has a distinguished leadership record globally advancing nursing education. She recently transitioned to Professor Emeritus at the University of North Carolina at Chapel Hill, the School of Nursing, and of course we certainly wish all of our friends and faculty and members in the North Carolina well with the advancement of Florence coming toward the coast. Gwen served as Associate Dean for Academic Affairs and then established a new position as Associate Dean for Global Initiatives. She also worked with Linda Cronowet, and she helped launch the Quality and Safety Education for Nursing, or the QSEN project. Dr. Sherwood is a co-editor and won the AJN Book of the Year on Quality and Safety, and also has 3 books on reflective practice, one of which is one of our textbooks for the university. She's very active in Sigma, and I know Gwen quite well, and it's really a pleasure to have her with us today. She served 2 terms on the Sigma board as vice president and currently chairs the Leadership Succession Committee. So with that, I'd like to turn it over to Dr. Gwen Sherwood.
I'm so excited to get to be with you at Western Governors. And this picture that's here opening our slide presentation is not at all the picture of what is going on. So we actually have a weather system coming from the west, and you may hear thunder going on in the background. We have quite an intense storm raging right now. And then, as Carol mentioned, on the coast of North Carolina, Hurricane Florence right at the blue arrow. So we are an eastern state, North Carolina, just above South Carolina. So South Carolina, North Carolina, Virginia. If you draw a circle, that's the area where Florence is heading. So there are mass evacuations underway. Grocery stores have long lines, and gas stations are already out of fuel. So we're getting ready to hunker down and hope that we all stay safe. But it is a delight for me to bring you greetings from the University of North Carolina at Chapel Hill and to be with you this evening. Now, even though I can't see all of you individually, I want you to think about 3 central questions. I think these questions are central to us every day. Why are you here? Why did you join us for this webinar? What did you want from that? So reflect for a moment on that question. Why did you choose to join this webinar? And then think about, at the end of this time, approximately an hour, what is it that you want to take with you? So they're not right and wrong answers. I ask this question at the beginning of my classes because I want to know why students came to class. Of course, when I ask undergraduate students, I mostly get because I want an A, I want to know what's on the test, but that's okay because then I know where they're coming from. And it's helpful to think about why you are where you are and doing what you are doing. It's important when you're on your way to work. Why are you going to work? What is it that you want to take with you at the end of the day? And thinking about purpose, thinking about what you want is also going to be important for you to think about, well, what am I willing to invest? So if I'm a staff nurse, I'm going to work because I want to make a difference in someone's life today. And at the end of the day, I want to be able to say that I got to know each of my patients, that I was able to identify some needs that they had, and I was able to do some things to make a difference. And if I think about that, then I will also begin to think about, all right, what am I willing to invest today? And so by thinking about the investment, we then begin with mindful engagement. Then we're no longer present because we just want to check off a box, just because we want an A on the test. We are present for a higher purpose, a clear purpose of what it is that we want to accomplish. What is our mission? So thinking mindfully about what we do helps us to engage. It helps us with a mindful approach. And if we are consciously thinking about what we are doing, therefore we are present in each moment, we are more likely to learn from that experience. And as we question and learn from experience, then we're moving towards professional maturity. So our objectives tonight are to describe some frameworks for reflective practices that clinicians, learners, educators, reflective practice can be used in all stages of life, whether in our personal life or our professional life. And then a second objective is to examine how we can apply reflective practice as we are trying to transform education and transform practice to improve the outcomes. So what is reflective practice? So let's look first, what is it to reflect? So I actually I was really old-fashioned and opened a Webster's dictionary. And some of the definitions are turning into or away from a course of action. That is to cause a change in direction. So if we think about the root definition from reflect, then we can begin to think about how reflective practice is to help us to think about our experience, to examine our purpose, to examine what we're willing to invest, to examine what actually happened, so that we begin to make manifest or to show what we are doing in a new and improved way so that we can perhaps change our course of action. So self-reflection is a mirror image looking into ourselves so that we understand our inner compass, that inner place where we identify our values, our beliefs, that inner compass that guides how we make value-based decisions and choices. And that's really important because that's at the very core of how we develop, how we think, and how we lead. So look at this picture. Now, I don't know if you can use the chat feature. And if you can, I can't see the chat feature, but I think Carol and Janine can. And if anybody wants to just say what pops into their head as what do you see in this picture? Let me know if anybody gives us any ideas what we're looking at with this picture. Anybody venture a chat guess? It doesn't have a right and wrong answer, but I'll tell you some of the answers that I have gotten before. A door. Did I hear somebody chatting?
Yep, someone chatted in the chat, a door.
A door. All right. Anybody else see anything other than a door?
A closet door, to be more specific.
A closet door. Okay. Anybody else?
Someone said an elevator.
An elevator. I can see that. Yeah. A ceiling.
A wooden door.
A wooden door. A Hershey bar. I think that's my most interesting answer. Well, let me ask you a different question about this picture. How many circles do you see? So in looking at this picture, were you able to actually identify that there are circles, or were you looking in the abstract and you saw all the rectangles? But if you look in the midst of each of the rectangles, you will actually find 16 circles. If anybody has trouble seeing the circles, let us know on the chat. I don't know if you can see my cursor move around identifying where the circles are. But often when we are at work, when we're involved in something, we're way up high on a surface level. We are not thinking deeply. So we just look at an abstract picture and we see what jumps out at us from the surface. So how can we develop awareness to see beyond just that first glance, to go beyond a preconceived idea? I had a front door that actually looked a lot like this. So when I saw this picture, all I could see were double front doors. And it actually took me several hours to find the circles. I looked this way and that way. And now I can't look at the picture without seeing the circles. So mindful reflection, finding the truth behind the surface. So we want to think about reflective practices that help us examine our experiences, our work, our events, so that we see beyond the surface, but to another level of truth. So reflective practice is rethinking, well, what could be changed? So if you look at a bicycle as a means of transportation and you look at a lawnmower as a means of mowing the grass, then you just see those two things. But what if you began to think about, how can I do something using a familiar tool in a different way? So we rethink into a bikomore. So reflective practice is helping us to rethink how we do things so that we really can get a new result. So thinking about your work raises the question of, how do nurses recognize and process critical events that shape practice? So whether you think about it consciously or not, whether you are an undergraduate learner, a graduate learner, a professor, a researcher, we all have a professional practice model. So I have not been at the bedside in some time, but I have a professional practice model that guides how I do my administrative work. I am driven by um, attitudes and values and beliefs and ways of being and ways of doing work that shape my practice. My practice is my work. Practice doesn't necessarily mean at the bedside touching patients, but think in the broad construct of our work. And so, how do we recognize those signature events that stay with us and that actually drive how and shape how we do our work? So, if you think just for a moment, you can probably think of some standout events that you have thought about and they stay with you when you encounter new situations. So, another question: how do we remain open so that we don't self seal? Self seal is a lot like premature diagnosis, where we lock into something first, where we automatically think if a patient complains of abdominal pain, well, it's gas, without thinking of what other things it could be. So we don't self-seal and have premature closure, but we remain open to situations so we can see multiple viewpoints. And then how do we make sense of practice? We are involved in our work with human beings and a lot of drama. And so how do we make sense of some of the things that are very confusing in our workday? And then how do we deal with contradictions that emerge from time to time? So what is reflective practice? It's really looking into the mirror of oneself. So by looking inward and examining ourselves, our attitudes, values, beliefs, assumptions, we are able to increase our own self-awareness. And we have to increase our own self-awareness in order to increase our awareness of other people and the impact we have on them, and our awareness of the overall context the work environment where we are or where events are taking place. Sounds a lot like emotional intelligence that I'm talking about. So reflective practice then is a way of seeing and responding to the world through a reflective lens. So it's not checking off boxes of tasks, but it's engaging with purpose, of thinking about why we're here, what is it we want at the end of the time, and what are we willing to invest. And therefore, we can think about then what's that confrontation with confusing events? How do we confront things that don't make sense in our world so that we can pick them apart and better understand them? So reflection is mindful thinking about what you do, mindful thinking. So it's systematic. And systematically, we consider different viewpoints, other ways of thinking as we are describing, examining, and reconsidering a situation. So we're trying to better understand what we think, what we know, what we assume. But the word systematic is really important. Now, I like to work out at the end of the day. And so I can go out, we have lots of green space in Chapel Hill, so I can go out to take my exercise walk. And I can think back on the day to meetings where somebody said something that kind of I recalled and went, oh, they're talking about me, and I take it personally. And out on the jogging trail, I can just pound my arms and I can think, man, if I had just thought to say so and so to them, and I can come up with all these zingers that if I had said that, I would have put that person in their place. That is not reflective practice. That's not thinking about our work in a systematic way. That's not reconsidering what we think and know and assume. To me, I call that righteous indignation. And righteous indignation is not what teaches us in a mindful way. So the word systematic, the word mindful are really important so that we begin to integrate knowledge, what we've been learning, our theoretical cognitive knowledge background, as well as previous experience. And by integrating that, we have a way of guiding our actions. Christopher Johns, who's been one of my mentors in learning about reflective practice, Chris is from England. He's a prolific writer about reflective practice, and he talks about reflective practice as making sense of practice, making sense of our work. And he has this statement: it's the person's ability to access, make sense of, and learn through work experience to achieve a more desirable, effective, and satisfying practice. So when I read what Chris wrote there, I think about how reflective practice can also be used not only to call up those things that are confusing and nonsensical, but we also call up star moments that bring us joy and satisfaction. And so reflecting on our work can also be a very positive thing to help us with our growth and development. So reflective practice is about learning from experience, how we systematically think about our work, we examine our experiences using critical reasoning, and so that we can have mindful action, so that we are purposeful in our work. We work by choice, not by haphazard or not by accident or trial and error. So we try to learn from each experience. If you think to your nursing school days and the different assignments that you have, you see how educators often are having you write in a way that you are thinking about what happened to you in your clinical learning or in classroom to help you to reframe it in another way so that you are developing knowledge from experience, tacit knowledge. So critical reasoning is a platform for learning through mindful engagement, sense making, thinking about our work from multiple perspectives to make sense of it and reconsider our choices for future situations. Now, again, I'm going to ask you to look at this picture. And I want you to think about your first impression, just the first impression that you see. And I want you to look at it for a moment. When I saw this picture for the first time, my eyes glazed over. I could only see a lot of color. It was almost like too many cylinders firing for me. But if we take a moment with this, we can begin to see some other images. And so our workday is like this. If we could put our entire workday in one frame, put all of our experience together, it might look like this picture. But if we stand for just a moment and study it, you will see certain figures begin to stand out. You will begin to notice that the lines have meaning, and you will begin to think about that there actually is a message in the picture. It's actually very busy community. And if you look at the picture, you begin to see all of the different faces and begin to make meaning. You are able to make sense of this by stopping and listening to what this picture is saying to you. Meg Morman has written in our Reflective Practice book, Visual Thinking Strategies, Going to the Museum, Picking Artwork, so that you begin to practice observation and communicating details using descriptive words and listening to what other people have to say. Because what I saw in the picture we just looked at, other people may give it an entirely different interpretation. What I saw as a community, someone else may see a very different kind of gathering or a very different image. And so visual thinking strategies can help us practice how we listen to other people's voice and listen to how they are thinking and communicating. And when we are able to do that, we are enriched and we are able to see our own experiences in a different way by listening and observing. So some of the research that has been done around visual thinking strategies, undergraduate students have said that previous picture is actually a lot like walking into an intensive care unit. That walking into an intensive care unit, all you see are tubes and wires, and it takes a while to make sense of what is actually happening to the patient. So reflecting on artwork, reflecting on experience, being able to open communication so that we can have differing interpretations. But it helps us to develop critical awareness. And so we go deeper beyond just the surface that we're going to work to accomplish a bunch of tasks, but we're going to work to make a difference in someone's life, to make a contribution. So reflection, noticing, engaging, thinking about what you are seeing and doing. So consider what you see. You have to first think about, well, what is the ideal practice? If I'm thinking about the reason I'm going to work, I want to think about it in the ideal way. And then at the end of the day, I may be exposing some contradictions and making sense of what I intended to do, but what actually happened. And so we have to stop and ask ourselves, well, why did that happen? What hindered me? When did I not follow what was my guide as ideal practice, that I made different choices? So this little list on the right side of the screen, BLEAR, I tried to make it into an acronym. It didn't quite work. But taking that pause, just that moment to listen, and listen to ourselves, listen to those around us, to take a breath. if you study mindfulness, you learn that breath is so important. And so just some days, all we have time for is one breath. But that one breath before you enter a patient's room, to picture, who are they? Why am I entering? And what do I want to accomplish? What's my purpose? And then engaging. And then reconsidering. How well did that go? What could I do differently? So reflective practice is helping us to see with a new lens. So the essence of learning through reflections is to surface contradictions between what we intend to do and what we actually do. Because of different intervening factors, or we lose our courage, we lose our way, we get distracted, we get busy, time pressures, all of the human factors reasons. So reflection demands that we confront ourselves and the conditions that limit us from achieving our very best. And so as we're able to think about it and identify what's limiting us, then we are more likely to be able to make that investment to make change. So often we are learning to write, but in reflection, we are writing to learn. So writing to learn reflectively is purposeful. It's helping to order thoughts. It makes a record of what happened. And in the writing, we begin to connect ideas, to make connection between events. It's also very therapeutic. So writing as relationship. And first of all, as relationship with ourselves, as we look inward, the mirror to ourselves. So I want to share an example of what could be seen as reflective writing and how that could be constructed. This example comes from Gail Armstrong at the University of Colorado, and she has her students write each day at the end of their clinical time. And this was the third or fourth week of the clinical time, and this student had been writing only about technical parts of nursing. So listen as I read the next two slides. I was assisting the burn nurse with changing the bandages and dressings and the removal of the staples that had been placed to adhere the artificial surface to his own flesh. So she was taking care of a severely burned patient. It looked as though he was healing fairly well. So now you hear that sticking with that technical perspective that she had previously written about. At first, I was intrigued with the process that I was watching, and then I looked at the face of the patient. It was plain that this was the first time he had seen the extent of his injury since he was admitted, and he was horrified. This experience was rich in carrying moments for me as a nurse. It was an awakening for me to put the human context to the clinical conditions that I have only read about in books or simulated in lab. This was not a limb with second and third degree burns to be debrided and bandaged. This was a person with a family to support and a crew of men who looked to him for their livelihood. This was a man used to being in charge of his environment and able to create things with the work of his hands. And now his life will be changed forever. So as we listen to that reflective writing that this student had done, we can analyze from several different points of view. So there are some reflective prompts that we could use. And if I were with you in person, we could have a discussion. What stands out for you in this case? What are you concerned about? What assumptions did you see in this story? What else could it be other than exactly what was written on the paper and other than what we have said in points 1, 2, and 3? And what do you already know that can help you in this situation? We could examine it from the standpoint of the learner, the standpoint of the teacher. We could also examine it from the standpoint of the patient. We don't know what preparation the patient had before the nurses entered the room to take care of the patient. We don't know, there's a lot that we don't know. but there are some things that we do know. We can bring knowledge of caring for burn patients. We can bring knowledge of sterile technique, of alterations to self-image. So there are many different ways that we could analyze this particular story to begin to develop clinical reasoning, self-assessment, and begin to use this reflective writing. So reflective writing, writing to learn, describe the situation as factually as possible. Evaluate what happened, what went well, what did it mean to me, and what might I change next time? And then consider the impact of the emotions, beliefs, assumptions that affect judgment and development of practice. So review and analyze from what you have had previously, because you begin to pick up pattern recognition as you analyze experiences to learn from your experiences. This is how you develop professional maturity, is beginning to learn in situations. There are certain patterns that emerge. And as you pick those up, you are advancing your own growth and development. For what lessons are you learning that you can take forward? So reflective practice really comes out of experiential learning, where knowledge is created by a process of doing and learning by reflecting on what happened. Kolb's experiential learning theory. So from the standpoint of reflective learning, we're asking, does it make sense? And from a transformation perspective, we are looking at how we are advancing our own clinical judgment and reasoned action. So taking a moment to reflect, to ask that question, does it make sense, is a really important question. I was working with a clinical instructor, and she was telling me the story of her dosage and solutions test. And she had been trying to teach her learners to always ask, does the answer make sense? To take that moment of reflection. So one of the questions was to calculate the solution and then select the appropriate syringe that you would use to administer it to the patient. So this particular student made a decimal error, and there was not a syringe that worked. So she started drawing additional syringes. And so she got to the bottom of the test, to the teacher's note, check your answers if they make sense. She went back to that question and thought, this doesn't make sense. Why would she want me to draw all these syringes? She didn't leave room to draw syringes. So she went back and checked her math and found her error. So the teacher called her in to talk to her about that, to learn what had happened. But taking that moment to ask that question, does this make sense? Does my conclusion about this pattern of signs and symptoms make sense? Does this medication I'm about to administer, does it make sense? It can really help us in developing clinical judgment and moving towards maturity. Here's another set of questions that, while they're not originally developed as a reflective process, for me, reflective practice is about asking questions about our work. So it's an inquiry, spirit of inquiry. So the Socratic questioning method, to me, involves a reflective process, because we're trying to learn patterns of how we think. So on the left side, we're trying to learn we're clarifying thinking, challenging assumptions, how we use evidence, what are alternative viewpoints, implications and consequences, and then just questioning the question. And on the right side are a set of fairly common sense questions. Well, why did I think that? How do I explain my thinking? Is this always the case? Why do I think this assumption holds here? Why do I say that? Is there reason to doubt this evidence? And what is the counter argument? Does anybody else see it a different way? If this happened, what else would happen? Cause and effect. And then Why did I ask that particular question? So, and why was that question so important? So, trying to develop a habit of the mind to always be asking questions. So, I'm going to now share another clinical reflection from Gail Armstrong that is a very different kind of reflection. So, this is from an undergraduate student. And I want you to think about those Socratic questions as we go through this, and we'll put those back on the screen after we go through the story. I had quite the striking experience at the bedside this week, one that I believe I won't ever forget. In my evidence-based practice class this week, we were discussing implementation of evidence-based practice, and these discussions have informed some of my questions. As much as we wish it wasn't still happening, many of our preceptors on the floor show us learners the right way to do a task and then the way they do it. When a nurse is showing me something her way, and I know from class or lab that it's not the right way, it can have a tendency to make me emotional for the patient. For example, this week, I inserted a Foley catheter and I took my time to do it the correct way that we were shown in our lab, and I talked to my patient. Later, I went into a room with my preceptor who was inserting a Foley. She put the same Foley completely in and out all the way to the Y bifurcation 3 times. She did this regardless of the fact it had the woman's menses on it, never once talking to the patient to let her know what was happening. In fact, the nurse was on the phone the whole time. So, let me get the slide to advance. Okay, I was in shock by these actions. I had never felt so far from our fundamentals lab. I kept thinking about the extreme risk for infection my nurse had created, and I've been wondering, why do nurses do things the wrong way when they know the right way? Is it a time constraint thing? Or did my nurse not want to have to charge the patient for 3 Foley catheters? Or did she not want to take the time to get off the phone and go down the hall to get another cell catheter? Would she feel guilty if she knew her actions had put her patients at risk for infection? As confused as I was by this role modeling, it has made me think about my own responses to time constraints, inconveniences, and putting patients at risk, and what I will do when I am in practice. So again, we can reflect and we can use this story in multiple ways to focus on what our learning objective was. So we can go through the same prompts. What stands out in the story, what we're concerned about, and what else could it be? We can also take the same story and by reflecting on it and helping to refocus it, examine it in terms of patient safety and quality. And we can think about this, reflect on this story with other interpretations. What knowledge informed this student's responses? What previous experiences impacted how she interpreted this experience that she had? What were her values that were exhibited? And we can also, again, we could have someone be the nurse and reflect on what was the nurse thinking. We can have someone reflect from the standpoint of the patient or from the clinical instructor. So we can use stories, and stories really are just our experiences. But let's think back how we use stories and how we developed this spirit of inquiry that's fostered by reflective practice. And so we could be any one of the characters in the story and ask about these questions to try to better understand actions that happened and why we responded the way we did, whether we're the nurse, the clinical instructor, who would get to hear about this story, and so on. So we can look at our experience in terms of a story by recording it in a systematic way, and we can employ differing prompts and questions to help us to reflect on it to better understand it. Chris Tanner says that's thinking like a nurse, asking questions as you think, and that leads to developing higher order cognitive processes such as clinical judgment, decision making, and clinical reasoning. So active learning, where we are comparing, analyzing, hypothesizing, generalizing, synthesizing, we are looking at an experience, a case, a story, and we are trying to actively learn. We are very purposeful about the questions we're asking. What is our purpose? What is it that we want to accomplish? And how we are willing to invest in that, the investment would be deep thinking, reflection, and anticipation. And as we engage in active learning, in that reflective mindset, we are actually fostering clinical reasoning. So our goal is developing reflective practitioners. Now, let's think about this story that we just had about the evidence-based practice and the Foley catheter and opportunities for reflection before action, in action, and on action. So as the learner recorded that experience, she talked about how she went to the evidence-based guidelines to reflect before she started her experience. She took time to plan what she was going to do. She asked the question, am I clear about what I am going to be doing? She was very purposeful, and she took time to invest in reflecting before action. Reflecting in action is a very interesting analysis in this story. She tells us how, in the moment, she was reflecting. But one of the questions that we will be asking is, there was no action, simply reflecting. And our goal would be, with maturity, to be able to call for a huddle. Let's get together. We're not on the same page here with what's happening. You stay with the patient. I'll go get a sterile catheter so that we can start over. I see that you are busy. Let me see what I can do to be helpful. I know we have power gradients when it's a practicing nurse and a student, but this opportunity to try to get on the same page is a very critical learning moment. And then reflecting on action, the debriefing, the learning. And since this reflection was written after the fact as a reflection on the clinical day, technically this is a reflection on action. It is a debriefing of what the learner accomplished, what the learner got from that experience about going both her own catheterization compared with when she went with the other nurse. So reflective practitioners reflecting before action, whether that's during transition time, between shifts, whether it's taking your own time to review evidence-based protocol, stopping in action takes a lot of thought. And some people say this is a really critical and high level order of reflecting in action. And then reflecting on action. Carol Durham at our place says that the learning from simulation actually takes place in the debriefing at the end, the reflecting on action to try to learn what happened in the simulation. So reflective practice, considering the full situation. I mentioned earlier, building emotional intelligence, raising questions, that consciousness of self, others, and context. And the two stories that we have listened to, when we talk about increasing self-awareness, I think we see evidence of that. Increasing awareness of others, and broadening to awareness of context. So thinking deeply about what's present in the situation, but also what is not, so that you can interpret and raise questions about what happened. I want to take just a moment to mention how reflective practice is helping to influence leadership development. We have a bit of a paradigm shift in how we are learning about leadership and influencing our community of practice. Leadership really is about influencing those around you, and for me, it's about trying to help everyone be their better self. Dan Pesant talks about wisdom leadership that recognizes both vertical and horizontal development. Horizontal development is about what you think, and so that's knowledge, skills, competencies, whereas vertical development, and we need both to balance the axis, is growing in our ability to think and act in complex, systematic, and interdependent ways. It's about how we think. So what we think and how we think, but trying to apply reflective practices in developing wisdom leadership, and thinking about how reflective practices grounded in mindfulness foster development of wisdom leadership, and how that helps us then to move from vision to action. It helps us to move from thinking about what is the ideal practice, what is our purpose, into trying to make it the way that we act. So reflective practice then is thinking about your practice, about your relationship with others, and about the way you feel about performing certain tasks. So really, in a sense, it's becoming more self-aware of your own practice. So let's think about this exemplar reflection and how you can think about events in your own practice. So I hope that you will take this exemplar here and think about an experience of your own that stands out, and think about what were the values that guided your actions. What goals guided your action? Because you want to bring together what actually happened and what was your goal. We often have this gap between what we wanted to accomplish and what actually accomplished. And so then being able to monitor our reactions. What was I thinking during the situation? And be able to learn from that experience to make sense of events so that we can think about what will happen in future situations. So I wanted to come back just a little bit more to Cole's experiential learning theory. And I don't want to spend a lot of time going into theory because that's kind of hard to do late in the day, but just to help you to see how reflective practice is grounded in his theory of connecting experiences and bringing in what we know and applying it, tearing it apart and putting it back together, much as you might do with case studies. I also wanted to bring up another model of reflective practice, which is called the DEAL model: describe, examine, and articulate learning. Here at UNC Chapel Hill, we have just undergone curriculum revision, and we are using the DEAL model for our master's synthesis projects, where they have an experience that they develop with their committee. And then after they have that experience in the real world, then they write a reflective paper using the DEAL model. I'm not going to go into the details of it, but I've given you the web link if that is something that you are interested in trying to develop, either for yourself, if you're a clinical educator and you want to help those who might be on clinical practice ladder, the DEAL model might work, or if you're teaching graduate education. So just a couple of things. I used a couple of reflective stories from Gail Armstrong's clinical experiences But I want us to think about how powerful stories are and how important it is that we take the time to think about our own stories. That's really just our own experiences. Experiences are actually stories that can teach us. Um, and as we examine those stories in a systematic way, using one of the guides that we've talked about this evening to examine, well, what beliefs are coming out in that story? We just used a model asking about what values, beliefs, goals guided the intentions. But stopping to think about particular experiences in a systematic way raises our awareness of what happened so that we make better choices in the future. And then it's bridging actual and desired practice so that we learn from experience and make sense of what's happening. So learning through reflection, just to bring this back again, this is what we've used 2 or 3 times during this session, but making a note of this in your calendar so you can come back and think about your experiences, not in that self-righteous way that I talked about when I'm out on the jogging trail, but in a systematic way where you're describing, examining, and thinking systematically what is standing out in the story and the assumptions, going back to that picture and finding those hidden circles that are in the midst of the rectangles and squares, and asking, how else could this story have played out? What would have been some choices and other ways that you might work with a particular situation, and think about other experiences that help you. So I mentioned clinical ladders and moving towards professional maturity a couple of times. Experts, Pat Benner did some work on what is expert practice 2 or 3 decades ago, and it still holds true. Experts grasp the whole of a situation. They have learned to recognize patterns and context. And so thinking about how we move towards professional maturity by reflecting on our experience so that we surface contradictions between intention and actual practice. And as we gain experience and expertise, we are able to do that more and more and make that a habit of the mind of how we confront ourselves and the conditions that limit us, and being able to call out why we are not able to achieve what we want. I've been working with some graduate students on SBAR, and I hope most of you are familiar with SBAR, Situation, Background, Assessment, and Recommendation. And it was not until we started doing some research on SBAR that I recognized the role of reflection and being able to construct an effective SBAR. To construct an effective SBAR, you have to be able to reflect on the situation, much like you would name a story, put a story together, or a case study. And the purpose of SBAR is conveying critical information from one provider to another so that that other person can make a decision. So if we're the nurse conveying information using an SBAR, we need to reflect on the situation to determine the critical information we want to convey, put it together in a pattern recognition, and to think about the best way to convey that so the other person can make the best choice. Because in the end, it's the outcome of the patient that is important. So I have still been thinking some more about how important reflection is in SBAR, and think that there is some more work that we might be able to do as we begin to claim that. So reflective practice, mindful learning, the cycles of interpretation. You will forget the words that I've used tonight, but you are likely to consider to remember the two stories that I mentioned, that the nurse who was transformed by recognizing what the patient with the burns was going through. The story of the learner and evidence-based practice and the Foley catheter. And you'll come back and think about that and go, oh, I don't know if I agree with Gwen about that. Let me think about it in this way. And that would be wonderful. So the different cycles of interpretation help us then. That's how we learn, is by continually replaying situations, going out, recognizing a gap in our knowledge, filling that knowledge gap, and then bringing that new knowledge in so that we're constantly analyzing. So reflective practice is about professional growth, moving to professional maturity. It's going from being task-oriented, checking off boxes, to thinking about our purpose, what it is we want to accomplish. It's asking questions about what we do. It's engaging, being mindful. It's trying to make sense by asking questions about our experience and knowledge, and analyzing and reanalyzing what we know so we reconsider actions. It's thinking about the intentions that guide our actions in situations, situational awareness, so that by asking questions, by being present and thinking about our purpose and intention guides what we do. So beginning to wrap up here, reflective practice helps us in knowledge development by using narrative pedagogy, using story unfolding case studies. It's that spirit of inquiry, asking questions, critical analysis of experience, developing clinical judgment as we move along towards professional expertise, growing from novice to expert, making sense of experience, grasping the whole of an experience, dealing with contradiction. So reflection for transformation, moving towards change. The conversations we have, the way we tell our stories, shape how we see the world, how we behave, and what we see as reality. So reflecting on our experience in a way of trying to tell and share how we perceive reality, to help us shape how we're going to form our own mental models and how we're going to direct ourselves in the future. Questions are really important. They help us to inquire and ask about what are the things that make us uncomfortable. Questions help us to move towards change as we reflect on our experience. So as we begin to close, I want you to think back why you did join this webinar and what are 3 points that you will take with you. And I want you just to think about that. Make some notes in the margins of your calendar, on a piece of paper, on an index card, and think about what you're willing to invest to move towards ideal practice. What questions are you willing to ask about yourself? And is there someone that you can engage in critical dialogue to help you to move towards success and practice development? So it's really about developing a mindset about how we think. So I'm going to end with a third story. A man passed by 3 men working, and he asked the first one, "What are you doing?" And the man said, "I'm laying bricks." He asked the second one, "What are you doing?" And he said, "I'm building a wall." He went to the third person and he said, "What are you doing?" And he said, "I am building a cathedral." So as we think about perspective and mindset, think about what each person brought: bricks, a wall, or a cathedral, where we come together with purpose and where we think of the higher calling, that coming to work with purpose and engaging mindfully, reflecting, calling up our experiences and analyzing them, thinking about our work and asking questions, and just thinking about which perspective best describes you, the task-oriented are the one with the vision to build the cathedral. So the journey to mindful practice, keep calm and reflect. So one last slide with some references, and my email is on the opening slide. And you can also find me on internet. You can find me through Sigma Theta Tau, and I would be delighted to answer any questions that might emerge. And I see Carol's picture, and she can let me know if any questions have come in on chat.
Sure. Well, we are checking. Janine, do you see any? So with that, Gwen, thank you so much. I am mindful of your professional commitments and really appreciate the time that you've spent with us this evening. Before I share some closing remarks, I'd also like to say I'd be remiss if I didn't thank Janine Barrett, who's helped moderate this program, our technology chair, and Jonette Benson, our program committee chair, who of course facilitated the ask and getting you to speak for us. I also want to thank all of our attendees today. I know how busy everybody's schedule is. And if you enjoyed this program, which I'm sure you did, please feel free to go back to our website. We'll have the recording posted on the website, and also encourage other colleagues and members to view this presentation. You don't have to be a member of Sigma to understand the value of this wonderful art of mindfulness. I also wanted to remind everybody that in honor of Dr. Sherwood's kindness in presenting to us, we are going to be making a donation in your name, in your honor, to the Sigma Foundation.
Oh,
so thank
wonderful.
you very much for doing this for us today.
Thank you.
You're very welcome. And I'll
Thank
reach out
you.
if there's a particular fund that you would like the donation to go.
Thank you.
So thank you. And then finally, as you know, our chapter is growing quite rapidly. After just completing 1 year of being chartered, we are going to be pushing our 1,000th member when we move into our October 10th induction. So I don't know who that person will be, and I'm not sure we'll be able to pin it down to one person, but please know that we make a difference. Our chapter through Sigma, through WGU, is making a difference around the nation. Our next induction will be on October 10th, and we encourage all of you to join us for that. And again, remember, as you think about the mission and vision of Sigma and the call to action by our current president, Dr. Beth Tiggis, we want to continue to connect with each other, and through mindful practice, connect with our colleagues and our students. We also want to think about our patients. We want to make a difference and collaborate with each other. And finally, always know that we are the ones that make a difference. It's through the catalyzation of our action, through mindful practice, that we can make a change in our profession and in the healthcare industry. So thank you all so very much for joining us this evening. And Gwen, truly, it was a pleasure having you with us. Thank you so very much.
Good night,
Good night.
everybody. Stay safe.
Yes.